So the final treatment for today's sequence is the nose. And as I mentioned before, Claire's concerned about the small indentation on this side. Let's systematically review the nose and how we determine what we can and can't treat. So if we start off from a profile view, what we can see here is that we have, I would say, a very aesthetic nose as it already is. We first can assess, do we want to address the tip of the nose? I think this nasolabial angle is optimal. First of all, the angle between the septum of the nose and the upper lip. Secondly, is there any interest in lifting the tip? Personally, I don't think so. In this case, aesthetically, there is no need to elevate the tip of the nose. It would also expand the nostrils and you'd see more of the nostril from the front, which is not really what we want. So I'm comfortable with the aesthetics of the tip and the nasolabial angle. We can see there is a dorsal hump, a very small dorsal hump, which we could straighten out by adding some product above and below. And in the process here, we can also apply a little bit of product to the lateral aspect of this nose here to address that little notch on the left side of the dorsum. We also need to assess the envelope of the skin of the nose, and it's a tight skin envelope, which means that we have the capacity to create definition. If someone has quite lax skin around the nose, sometimes they're not the best candidate for hyaluronic acid filler because we struggle to create the definition just under the skin that we're trying to achieve. Having said that, it's really important that our treatments are in layer 4 of the nose. We want to be injecting along the perichondrium in the lower third of the nose and the periosteum in the upper 2/3 of the nose. We know that the major vessels of the nose travel in the subcutaneous depth and intramuscular depth, and so we want to be beneath all of that in order to treat the nose. Having said that, the nose is always one of the highest risk zones of the face, and so anything we can do to minimize risk in the nose is important. In this case, I'm going to be using a 25 gauge cannula, and I'm going to be making a single entry point in the tip of the nose to try and address the dorsum with a cannula alone. So rest your head back for me.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
And we're going to start off with some lidocaine to try and make things a bit comfortable, but the initial sting can be a little uncomfortable. So here it comes. Well done. Okay, a little bit of stinging. Bear with me. Well done. That's it. That's the worst part. The worst part of the treatment done. And then, as with the forehead, assessing the nose from the top of the bed is often the best way to do it. So if you just raise your chin for me, head up. What I want to draw on here are some of these aesthetic lines. So we have these very beautiful lines extending from the eyebrows down to the dorsum of the nose. And any break to these lines is quite obvious. And you can see she's got very good continuity for these brow to nose curves that come down. As I follow the lines down, I'm at the dorsal hump here, and here is where I get my first break. If you notice, between this line and here, it's discontinued. So I want to create some structure up this side of the nose dorsum. Again, I've got the line here, and then it stops. And this is where I want to create some definition all the way through to the nose tip. So the nose tip, the dorsal hump, and the brow to nose aesthetic lines are intact, but we have two gaps. We have the gap below the dorsal hump, and we have the gap above the dorsal hump. And if you just raise your head forward, it's this side of the gap that's a little bit deeper, and this is what's causing the notch that's causing the concern for Claire. Maybe this is easier if you sit forwards and then turn your head this way. And you can see the gaps in the aesthetic lines that extend from the brows down to the tip of the nose. And this gives me a framework for how to inject the nose in this case. Head back. So let's keep those lines on. I'm going to make my entry point now into the tip of the nose. Just through the skin. This, again, I'm going to leave in the nose for 10 seconds to make sure I haven't cannulated an artery. With my cannula, I've got the exit port of the cannula facing forwards so that the projection of the filler is going in the right direction. And now we can start to treat. So as we move through the very, very thin subcutaneous plane, we have to push through the fibromuscular layer 3 until we're in the deep plane of the nose. And it will look a little bit like this. First thing I'm going to do is advance my cannula beyond the dorsal hump. The right depth should be gliding in the nose. There shouldn't be any resistance. I'm now above the dorsal hump, and I'm going to create some volume to try and create a straighter dorsum. I'm focusing here on the left aesthetic line, adding some volume to the midline, and then to the patient's right aesthetic line. 0.1 mil of Reviness shape injected so far. I'm going to stop injecting at the dorsal hump because there's already some projection, and then I'm going to move below the dorsal hump and start injecting again. So treating this patient's left aesthetic line, and then moving and treating the patient's right aesthetic line. And then some extra focus here where the notch is on the patient's left. And now we can review our progress. I'm now going to take off all the lines because we don't need them anymore. We're going to move to refinement now. From the side, actually, I have seen that the nose is significantly straighter already. And so I'm going to use the next stage of the treatment to just address where I see little interruptions in the definition of the nose. And I see that mostly at the lower third. That's now addressed the gap that Claire was worried about on this side of the nose.
Oh, wow.
And the final thing I'm going to do is I'm going to create a strip of midline filler down the entirety of the dorsum of the nose, which is going to then give us a very nice light reflex. On camera or in the mirror, there will be a beautiful slim definition to the nose. When I do this, we've got to be careful not to add too much projection at the dorsum again, because that will create another dorsal hump. So I'm going to create the midline definition above and below the dorsal hump, all the way down the nose with the exit port of the cannula facing forwards. So I'm in layer 4 of the nose, all the way up to the radix of the nose, and I'm slowly injecting now. And then I'm going to stop injecting at the dorsal hump and continue injecting again. And then stop at the tip. And this is the end of my nose treatment. It's worth looking at the top from the patient to see how we've created. I'm very, very happy with the definition and the midline position of the nose. We have to assess capillary refill at the end of any nose treatment. So in particular, I'm looking at the tip of the nose. Very fast, less than 1 second capillary refill. No skin discoloration. Any severe pain?
Nope.
Nope. And importantly, pinprick bleeding at the tip of the nose. Bleeding is good, okay? In the case of a vascular event in the nose, we may not see any bleeding where our cannula entry point is or our needle is. And then, so bleeding is a reassuring sign at the end of our nose treatments. So now if I sit you forwards, please, and look into the camera. I hope you can appreciate here a change to the position of the nose, the aesthetic lines going from the brows down to the tip. I turn the head face all the way this way. Very beautiful, straight dorsum of the nose. And all the way this way. All right, Claire? Mm-hmm. We're done. Great. I'm going to show you in the...
Wow.
I'm going to show you in the mirror now. Have a look here. Tell me what you see.
So it's completely gone. It didn't. Yeah, my nose does look a little more like straight.
Yes.
Like narrow, like much nicer. Oh, that's gone. It looks really good. I'm very happy.
Yeah,